coronavirus infection, which is biggest pandemic of this century, which affects almost all the systems of the body, particularly the respiratory system. And it is also a big challenge for medical fraternity because doctor is not aware the changing nature of the virus. And there are variety of symptoms. So, and treatment is also not available at that time. The social media is also a big challenge for us, and this new generation doctor misguide the patient and also create panic situation in the patient. Post-COVID syndrome disorders is defined as the signs and symptoms that develop during or after an infection consistent with the COVID-19, which continue for more than 12 weeks and are not explained by alternative diets. It is also named as long COVID, post-acute COVID-19, long-term COVID, and so on. In my clinic, I had treated 219 patients of post-COVID syndrome during July 20 to August 22. Out of these 219 patients, 35 patients have other comorbid conditions like cardiac problem, nephropathy, etc. So I referred this patient to their respective specialists. So total 184 patients I have treated. Out of these, 96 male and 88 females. The time period I also already mentioned. The age range in male 28 to 67 years and in female 32 to 69 years. The 123 patients visited after 14 to 16 weeks of COVID recovery from the COVID. They mainly have cough, loss of smell, impairment of taste, and general weakness, chronic fatigue syndrome, etc. 38 patients visited after 20 weeks. They have chronic fatigue syndrome and unusual body ache. And 23 patients visited in our clinic more than 20 weeks. They have chronic fatigue syndrome, neuritis, general weakness, and body ache. These 184 patients had more than one system involved and had symptoms accordingly. This slide shows you the different respiratory symptoms and with number of patients. And this slide shows you the different symptoms of neurological disorder, neurological symptoms. And this slide shows you the GIT symptoms, different GIT symptoms. 49 male patients had diabetes and hypertension. Out of these, 12 patients is on insulin and 38 female patients are diabetic and hypertension. Out of these, 5 patients is on insulin. 8 male patients had only diabetes. Now, when the patient comes to our clinic, first we review the previous treatment, then do the medical examination, both conventional method as well as PCM method. If needed, then we do the routine laboratory test, X-ray, CT scan, particularly patient complaining the chest symptoms or respiratory symptoms, and ultrasonography of abdomen, patient with abdominal problem. This slide shows you the list of acupuncture points we use during the treatment. The acupuncture treatment we plan to stimulate the acupuncture point, we use the disposable needle with all aseptic precaution. One sitting is of 20 minutes and first course of treatment is of 15 days, 10 days continuous, then gap of 1 week, then again 5 days continuous treatment. And after that, after gap of 2 to 3 weeks, we plan the follow-up treatment. Generally, patient needs 3 to 5 follow-up, and in some patient, more follow-up is needed. Along with acupuncture, we also use laser needle. It is used particularly in the cases of the polyneuritis, myalgia, chronic fatigue syndrome. The total dose of per acupuncture point is 4 to 6 joules. We also use the cupping therapy, cupping massage for myalgia cases, retention cupping in the particular respiratory and GI problems. I got an email in September 20 from the Vega Med, who is the manufacturer of the Vega test machine. That Vega method is helpful in diagnosis of different deficiency and other problems in the post-COVID syndrome. Matrix regeneration therapy I also use in the chronic fatigue syndrome for detoxification, myalgia cases, insomnia and abdominal symptoms. In result, I am taking different symptoms. In the respiratory dry cough, total patient is 92. For their assessment, we use numeric response scale, which is 11 parameter. It is 11 point scale from 0 to 10. 0 to 2, very good. 3 to 5, good result. 6 to 8, reduced frequency. And 9 to 10, no result. This slide shows you after third follow-up treatment, 39 patients score between 1 to 2 means good result, and 14 patients 4 to 5 means good result, and in 31 there is no result, and 21 patients not come after first course of treatment. The overall effective rate is very good result in 42.39 patients and good result in 15.21%. Breathlessness, total patients is 27. 7 patients had some patches of congestion on X-ray examination. After first course, 14 patients felt 30 to 20% better. And after 3 to 4 follow-up treatment, 16 patients felt very good result. Overall effective rate is 59.25% and not much improvement in 40% patient. This 11 patients has chest pain. All patients had history of dry cough. As the cough is reduced, the chest pain is gone. Abdominal pain, 20 patients, we use acupuncture, cupping and probiotics along with MRT. 11 patients has, after second follow-up, they have good result. Total effectiveness is 55%. And after second follow-up, 16 patients had very good result. Total effectiveness is 80%. In cases of diarrhea, 21 patients, we use acupuncture, moxa, cupping, probiotics and matrix regeneration therapy. After first course, 8 patients gives very in 8 patients we found very good result. Total effectiveness is 55%. And after second follow-up, 17 patients had very good result. Total effectiveness is 80%. In neurological symptoms, main symptoms is chronic fatigue syndrome, myalgia and weakness. So in weakness, there is 101 patients. We use acupuncture, cupping, massage therapy, and for assessment protocol, we use the numeric response scale. After second follow-up, the 46 patient has very good result, 29 has good result, and 10 patient not come for after one course of treatment. Overall improvement rate after second follow-up is 74.2%. Chronic fatigue syndrome, 71 patients. In this, we use acupuncture, laser acupuncture, matrix regeneration therapy, moxa, vitamin D, and multivitamin. And assessment of the chronic fatigue syndrome, we use Calder fatigue scale. It is 11-point questionnaire with a minimum 0, maximum 11 score, and cutoff is more than 4 points. This slide shows you Calder chart, 11 questionnaires. After fourth follow-up treatment, 52 patients reported very good results on the Calder fatigue scale. Overall improvement was 74%. In headache, after total 84 patients, we use only acupuncture, treatment assessment scale is numeric response scale, and after fourth follow-up, 49 patients has good result and 20 patients had some improvement. 15% not come after first course of treatment. Overall improvement after second follow-up was between
Dr. Patel,
60 to 70.
You have to speed up because time is.
Oh, right.
Okay.
I just finished. And in sleep disorders, 70 patients of chronic fatigue